We're here today at the launch of the Access Bank Solar for Health. And to take us with an opening prayers, I would like to invite Taiwan. A round of applause for her, please.
Good morning, everyone, and happy Women's Day. Okay, so shall we pray? Yes, thank you. In Jesus' name, we thank you, Lord, for this morning, and we come before you with a heart full of gratitude as we gather for this Solar for Health event, an initiative designed to bring hope, light, and sustainability to our health sector. We thank you for the vision, the wisdom, and collaboration that has brought this project to life, and we acknowledge that without you, none of this would have been possible. Lord, we ask for your presence in this gathering. Bless every speaker, participant, and stakeholder here today in Jesus' name. Grant us wisdom, unity, and strength as we embark on this journey. May this partnership flourish and lead to greater impact in years to come. In Jesus' mighty name, we have prayed. Amen. Thank you.
Our vision: to be the world's most respected African bank. Right now, can we all rise as we take the national anthem? Media. Thank you very much. Can we all be seated? Once again, you're all welcome to this very outstanding event, the launch of the Access Bank Solar for Health product. This initiative is our way of contributing our quota as an organization to ensuring a greener and a more sustainable future. Okay, so we'll just go straight into recognizing some of our guests who we have in our midst. I'd like to recognize the presence of the Honorable Minister, Federal Ministry of Women Affairs and Social Development, Her Excellency Imam Suleiman Ibrahim, ably represented by the Special Technical Advisor on Climate Change and Green Economy, Prince Xavier Iyama. A round of applause for him, please. We have in our midst as well the presence of the Executive Director, Risk Management, Access Bank PLC, and the Chief Sustainability Sponsor of Access Bank, Dr. Greg Jobome. A round of applause for him, please. We also have in our presence beg your pardon, Professor Magnus Onoha, the CEO of Renewable Energy and Energy Efficiency Association of Nigeria. Beg your pardon. A round of applause for him, please. We have in our presence as well the CEO Consistent Energy Limited, Dr. Shego Ajanu. A round of applause for him, please. We have in our presence as well Dr. Tefa Kenneth, the CEO of Harvey Health Sense Limited. A round of applause for him, please. We also have the CEO of the Center for Integrated Health Programs, Dr. Bola Oyeledun, ably represented by Dr. Ian Ayo. A round of applause for her, please. We have in our presence as well the CEO of Alien Synergy Limited, Dr. Jacob Machuku. A round of applause for him, please. Also is the CEO of Gamba Food on Wheel, Mr. Ismail Diana Mercy. I beg your pardon if I didn't pronounce your name correctly. A round of applause for her, please. We have in our presence the CEO of Optimal Health Consult, Aramide Yusuf. A round of applause for her, please. Thank you all so much, and a round of applause for each and every one of you for being here. You're welcome once again to this very auspicious event. And right now we'll hear from our Chief Sustainability Sponsor, Dr. Greg Jubome, as he brings to us our welcome address. A round of applause for him, please.
Good morning, everyone. It feels like Christmas Day for some of us who have been on this journey for a while. You are most welcome. I welcome everyone on behalf of the Executive Management of Access Bank. I welcome everyone on behalf of the Sustainable Finance Group of Access Bank. Everyone is excited. You might not be showing it right now, but they've been working tirelessly, along with so many people in this room today who have been working really tirelessly to make this happen. So many things to say, but I'm mindful of this, that this is a little welcome remark, and I won't overlabel the speech. But I feel things that are important to say, and I'll try and capture them. The first one is that all of us here were keen about health. We are all senior health practitioners in the country. We're all people that are passionate about health. We're committed to healthcare in Nigeria, every single person here. And globally, this is very well recognized as well. Even the Sustainable Development Goals, health is one of the pivotal goals inside the SDG. Without the health, probably about 10 of the other SDGs will disappear, because first of all, you need to be alive. We're talking about all the other SDGs. So it's a pivotal one. If we get health right, then most other SDGs will also follow. So as you're ticking that one box, you're actually ticking several boxes inside the Sustainable Development Goals. So that's a fundamental thing that we all realize, and we are working in Access Bank for impact on that particular goal. Because impact is not just about throwing money at something, although that is fundamental. Impact is also about understanding how to spend that money. It's also very pivotal. And working on a product like this means that we had an opportunity to shape it in a manner that is impactful, with optimal impact for our people. Now, take me to the concept of co-creation. It could have been easier, in some sense, for Access Bank to just say, you know what, we have some healthcare-related products, for loans, we designed it, we threw it at the market, we start marketing it all over the place. But in September of this year, I think it was September, We were very honored to participate at the Alliance Conference, the Renewable Energy and Energy Efficiency Association Alliance Conference in September. And at that event, we met with the president of the Alliance, we met with Dr. Tefa, we met with a few other really keen and eager practitioners in this space. And we said, why can't we have a product that is targeted across the country and it is delivering renewable power to all medical infrastructure, establishments, clinics, laboratories, etc., right across the country and eventually across the continent. And we said, why not? We said, oh, we have something already, we have some solar products already. They said, no. Can we have something that is specific, is bespoke, fit for purpose for the health sector? So we put on our thinking caps, put a team together, some from Access, some from the Alliance. We all work together to try and create something. And that's what they call these days co-creation. I think we have some digital people here. So this co-creation is what we are launching today. While it's an Access Bank product, it's the product of all of our collective efforts to create something that truly works. So it can be owned by the sector. And that is why the sector's participation is probably the most valuable thing at today's launch event. Because by owning it in such a manner, it means that Access Bank becomes a supporter, really, a cheerleader. Because the rich, the communities involved, the people involved, the players involved, it is from the health sector that they are all emerging. So we are just an enabler to ensure that we're able to achieve the impact that we're seeking to achieve. And that impact is not in hundreds of thousands, it's in millions. Literally, it's in millions, right across Nigeria. So we can all be truly proud of ourselves for bringing this to fruition today. We all deserve a round of applause. So I'll wrap up shortly. There's so much to say. Maybe we'll be saying more as we go along. There are a few things that we're doing. In my own group, the Sustainable Finance Group, what we decided to do is to have a health outreach on the back of this. And typically you will have like a retreat every year, but we'll say that we're not going to have a retreat just for staff to get together and talk. So this year we said we're going to go to a community and have a medical outreach there as the signal of our retreat for the year. So no more just sitting around and eating amongst ourselves and talking banking. We're going to do it in the community, in a particular community that we've selected, and it's going to be a health outreach in that community. We want to go to communicate about medical care. We're going to communicate about themselves, individuals we're going to meet in that community. We've already made some inquiries with the community. We've met with the heads of that community, and we're looking forward to making that a reality. There's going to be tests, all the normal tests that you medical practitioners you are even best at. And my team said to me that I should also, as part of my welcome speech, mention it to everybody here today, that in any way people can support that outreach to that village, to that community, we're more than happy. If there are people here who want to be able to be there to do the scans for something that is possible on that day, please feel free. We want to do all the normal blood pressure, tests for this, tests for diabetes, all those quick and ready tests that can be done on that day. We're more than happy. In the course of today's session, you can sign up any people here who would like to participate in that outreach. So having said all of that, Access Bank, we're immensely proud to be associated with everyone here, with the health sector. You are most welcome to today's deliberation, and it wouldn't have been possible without all of you playing the key roles that you have played. Thank you, and let's have a great launch event.
Can we have another round of applause for our executive sponsor? Thank you very much, sir. So 2 things you've said really stood out to me. The fact that our gathering today is an offshoot of a collaboration between the financing sector and the renewable energy sector. And it really speaks to goal 17 of the SDG that really emphasizes the importance of partnerships. And we hope to see more of this. And we say thank you to the Renewable Energy Alliance and other Renewable Energy Association of Nigeria for this. A round of applause for themselves, please. Okay, so we have more people we really need to recognize. I'd just like to recognize a few more people before we go into the crux of today's event. We have the CEO of Reddington Hospitals with us, Dr. Adeyemi Unabowale. A round of applause for you, please. Okay. We also have Dr. Shola Oluwole, the Group Director Project at Reddington Hospitals. A round of applause for him, please. We have Ms. Unoma Grant, the co-founder of EEN Consults and an IFC Edge expert. A round of applause for her, please. We also have in our midst Dr. Ngozi Onya, the MD Pelion Memorial Hospital. A round of applause for her. Okay, we have the Medical Director, Hartwell Hospital, Dr. Usim in our midst as well. Can we have a round of applause for her? We have in our midst the President of the Women in Renewable Energy Association, Dr. Anita Nana Okuribido. A round of applause for her. Okay, good to have you, Ma. You're welcome. And we also have Lady Isioma Fidel Ewerem, an executive from the Women in Renewable Energy Association. A round of applause for her, please. I think it's Women's Month. I think they deserve a more resounding round of applause. I think we can do better than that. A round of applause for them, please. Thank you. Thank you all so much. So we'll go straight into the presentation of the Solar for Health. And to do that, we would like to invite Mrs. Njideka Esomeju to the stage. Can we give her a round of applause?
Good morning, everyone. I think this is Women's Month, and we deserve a resounding applause from the men, actually, not the women. So can the men clap for the women? This is Women's Month, and we should celebrate our women. Thank you, thank you, thank you. My name is Njideka Esomeju, and I'm the head of products for Access Bank. And to help me make this a very good, memorable presentation, and like Greg said, is a collaboration. I'm going to call Dr. Tefa to come join me so that we can have a good presentation that shows that we actually did work together to come up with this product. Dr. Tefa, please. Thank you. Thank you. Welcome. Thank you, sir. So it's not going to be a long presentation. Greg has done most of the work. It's just to take us through and you ask questions. So Dr. Tefa is actually here to take most of the questions while I do the speaking. So he'll take the bulk of the questions. So next slide, please. Like Greg said, this was designed specifically for the health sector. We, as a bank, and in line with our sustainability goals, we didn't want to have a product that is for everybody, one size fits all. So in collaboration with the Alliance, Dr. Tefa's team precisely, we came up with this product just to make sure that we're actually having a sustainable, clean environment. And the fact that most of the time we have to use our generators, this is cheaper in the long run. There might be a bit of a capital outlay, but at the end of the day, you have clean energy, it's sustainable, and it's priced right. Next slide, please. So we have, the good thing about it is that we have accredited vendors. So all the vendors that are part of this program have been accredited by Access Bank. You're going to have a bit of warranty for the period of the life of we have about 4 years for the life of the equipment. And if there are any issues, you can have recourse to the vendors. So I think one of the things that made people, or make people shy away from taking up things like buying solar power and everything is the fact that they are not accredited. So we went the extra mile to make sure that all the vendors that will be involved in this are properly accredited by us and by the Alliance as we agreed. It's for hospitals and medical facilities, for laboratories. So whichever business you're in and you're in the health sector, whether you're a small clinic or a big hospital, you are able to have access to this financing. And please, you can ask questions when we finish presenting. Next slide, please. Let me talk about the rate so that Dr. Tefa can talk about the other things. So let's go to the next slide, please. So it's priced at MPR plus 2, which is about 29%. You have up to 200 million you can take in the facility. The tenure is for 48 months. And we'll try to make sure that it properly aligns with your cash flow so that you don't have any issue. We're going to work with whatever your cash flow throws out is how we're going to make sure the facility is structured. So there are monthly installments. If you wanted to do it quarterly, we can do quarterly installments, but it has to align with the cash flow of your business. So this is where I will allow Dr. Tefa do a little bit of talking, if he won't mind. Thank you.
Okay, before I say anything, can we do something together? Today is International Women's Day. Can we all stand up and respect them? Have this.
Thank you.
Can we all stand up and respect them?
The women should sit down, please.
So while you are standing, take 1 minute. If you can close your eyes, that'll be fine. If not, just imagine a pregnant woman in your village tonight. A pregnant woman in your village tonight who comes to the hospital in labor by 11 p.m. The doctors make a diagnosis of ruptured uterus or there's need for surgery. And then he goes on to request that the generator should be put on. Someone says there's no fuel. That woman is referred to the nearest hospital. On her way to that hospital, she died. Remember, we are celebrating International Women's Day. Imagine a scenario where that child, a sickle cell child, requiring blood transfusion. 2 units of it. The first unit is gotten. The other one is supposed to be kept in an environment that is conducive. There's no light. That is why all the engineers in this house have a responsibility to the health sector. We need to build a nexus between the energy sector and the health sector, using solar as a tool to improve the health system. Imagine that village is from Delta State. Imagine your village. If we are able to do this, we'll be starting a situation that will outlive us. And the truth of the matter is that we need to do it. Please, can we sit down?
Thank you, Dr. Thank you.
So, we've been on this since last year, and the idea is simple. How, whatever the rate that she has quoted, I'm not an accountant, I'm not a banker. The idea is that whatever rate that's going out there should be equal or less than your monthly energy expenditure. Put generator and fuel put together. Once that rate is below that, it means that what we're simply doing is we're asking you to provide solar to that hospital while they use that, what they're already spending to solve the problem in 4 years, and the remaining years, they have solar for free. Am I making sense? This is the philosophy behind what we're doing. So, of course, for the nexus to be built between the energy and health sector, on that aspects, finance is involved. I want to thank you very much, Greg. You told me last year that this is doable. The dream is real. Today I'm here. The rest of my career life will be different because the pain of every doctor in this hall will be removed by the engineers here. So thank you very much for putting up that conference together in Abuja. Do you know I was not invited to the conference? I only discovered the conference. And that discovery... I only discovered that conference like River Niger was discovered by someone else because the conference existed. So the package is this way. It's going to, this advantage is first, improve service delivery and patient outcome in healthcare. No patient to die again because power is not available. That is our goal. The second point is offer costs that covers your energy solution. And the third point is this. It's the same principle. My team put up this formula that is simple. 7 plus 3 equals to 10. What is 7? SDG number 7 is renewable energy. So the engineers are here. They will tell us all the stories, the advantage, disadvantage, give us the right product. So it's not about picking product and mismatching them. They are here to give us the product match and have a solution for us. What is SDG number 3? Good health and what? Once you put 3 and 7 together, you get 10. What is 10? Reducing inequalities. So the same health services that the hospital in Lagos is providing, that the woman in the village in Delta State will also receive. Because if power is needed, there's no pause again for us to provide power. Solar get to them. And providing solar alone solves 50% of the problems. Great for the community we are going to. I think we should extend it that by the time we arrive, in 3 days, the primary care facility should have solar. And I'm sure we are here, people can make contribution to that and it will happen. I believe in you, I trust you, and we can do it. Next slide. Maybe we'll talk about the features.
Dr. Tefa, thank you very much. You've made it very simple for everyone, and I'm happy that we all align with this. So our goal is go to market. There's really nothing more to say. We're here. Thank you. Thank you. We're here to provide those services. Our colleagues are here. Greg is here. Even if you don't get anybody in this building, you must get Greg. That's the one we're sure of. So please, we'll employ you to go to your branches, the nearest branch of Access Bank, and get all the information. Where we have a QR code that you can scan and start registering. So we can bring out the QR code that you can scan and register your interest to be part of this facility. And we'll appreciate it if all the associations represented can tell their members. If you let us know how we can get in touch, we'll come and make those presentations ourselves. You don't have to do any work. We'll make the presentations, and like Dr. Tefa and Greg and all of us agree here, let's have a revolution by the end of the year and see what this throws out. Thank you very much, everyone. Thank you.
I believe that presentation deserves a more resounding round of applause. So Dr. Tefa's analogy brings to mind something that happened sometime last year. So here at Access, as part of what we do, our colleagues undertake community programs independently, right? And one of my colleagues had reached out to me to say that one of the primary health centers that they had adopted had the same issue. And a group of staff within the organization came together and had to solarize a particular PHC. And I'm glad, super glad, that this product would cause impact on a larger scale. So let's give that a round of applause. So we'll go straight into taking goodwill messages from some of our guests. In no particular order, I would like to invite the president of the Renewable Energy and Energy Efficiency Association, Professor Magnus Onoha. A round of applause for him, please.
Please permit me to hide under the existing protocol established. You know, when Greg started by introducing the concept of co-creation, it gladdens my heart. Co-creation is a group of people with new ideas coming together to create what? New thing. You know, you saw what happened less than 1 year of this collaboration between Alliance and Access Bank. We have seen what Dr. Tafa have rolled out in terms of value addition, in terms of the number of vendors. I was just sharing with Dr. Shegu. The number of vendors across the associations, WAE, CREN, RIAN, everybody's here. It's a challenge. And you know, the aspect, or the common thing or product we have within this renewable energy space is carbon. And we're doing solar health, we're making a statement of the fact that the rural women, youth, the physically challenged, are going to breathe clean air using solar. And by so doing, to a large extent, I'm just imagining the kind of, if we are to take this to the carbon market, I'm imagining the kind of CO2 we're saving in the process, and Access Bank will be out there happy to make sustainable profit under the share of proceeds. What the government is going to get, what the private sector is going to do, even the civil society and all that. So you see, the journey is far, but we've started. So the foundation of this co-creation, this project called Solar Health, is amazing. So put your hands together for Access Bank, for driving the process. Because I remember when we had the business meeting at B2B, that was where I did Dr. Tafa, and we were very clear about this. This is not about talk shop. We are continuing that investment summit this year at the Go Hotel in September. And I look forward to so many ideas that will filter out in the process. This is just an aspect. I think in our partnership, we're going to have over 300 projects. And I'm sure it's doable in the next 2 years or 3 years. And I'm very, very sure. It's not about practitioners here. All of us here are active participants in this process with this solar health. So I'm excited. I'm excited more than ever. On behalf of the Board of Trustees, the Governing Council, and I have three presidents are here already. All the 7 president associations and association members of the Alliance that make up the Alliance, 7 association members, I want to thank Access Bank. I want to thank the arrowhead of that Access Bank, Dr. Greg and his team. And I want to thank Dr. Tafa. And especially I want to thank the Minister of Women Affairs. Because I'm beginning to wonder, because these climate change issues, what I would like to say that is the women that are much more vulnerable, whether in the health sector or in the agricultural sector, in the power sector. So women are supposed to be in the driver's seat. And so go and tell the minister that we're proud of her for how to have identified this. That shows that, yeah, she knows what she's doing. So people think it's all when you come to dance and all that. Solar health. I'm sure the preponderance of 60% are for women, and 40 for men or women, even though physically challenged or people with special needs. So we are good to go. At the end of the day, Access Bank, the Alliance members will be running home with our sustainable profits. Beyond the fact that we're going to do the social components, livelihood, the impact we're talking about now, the livelihood is going to be built because many people are going to earn money in the process and they've been engaged, and there was also what we call environmental integrity, clean health in the process. So I want to thank us for this innovation. Co-creation is the new thing, is the new thinking. Co-creation tells us that we two heads together, When they put heads together, they say when you piece, it forms. Co-creation is about partnership. Co-creation is about impact based on the theory of change. So I want to thank us. For those of us here, just as I conclude in my closing remark, take this in economy, we call it a concept of multiplier. The multiplier. If I bring one now, if I bring one, what do you call them? An active party, somebody, if I bring one, I look forward to, in the next, at the vendor, so to speak, in the next 10 years, or in the next 2 months, that one person I brought will bring another person, that the multiplier. So I look forward to, in my chain, I look forward to 20 people in the next 2 months. It's doable. It's possible. Because all of us need health. It's 24 hours stuff. So thank you so much. It's a challenge on all of us. It's a challenge on all of us to put in, let's have this army of vendors. Army of vendors that will be in the process. So on behalf of the Alliance, we support this. I will continue to encourage more co-creators, inventors to be in the process. Thank you, and may God bless Nigeria.
Thank you so much, Prof. So we'll go to the next goodwill message we have here from Dr. Adeyemi Onabowale, the CEO of Reddington Hospitals, ably represented by the Group Director Project, Dr. Shola Oluwole. A round of applause for him, please.
Thank you very much. I'm just going to talk off the top of my head because I was not given any. But first of all, again, I stand on all existing protocols and congratulate the group that has put this together, Access Bank, the sustainability group, and the Alliance of Professionals in this industry. We have been considering solar energy for quite some time. Just as to give context, every month we spend about 30 million naira on diesel at the Reddington Hospital. If you multiply that by 12, that's 360 million in a year. So you start to see the reason why there's a need for a different model. And that's with 2 generators. That's not talking about the maintenance of the generator. That's not talking about other things that are part of the system. So about 2 years ago, we started looking at the possibility of having a renewable energy program. But the cost at that time, when we looked at it, was well over 400 million naira. In today's naira, I'm not sure where that comes to. But the system that Access Bank has, or rather the program that they're putting together, allows you to really spread that over 4 years. And if we look at what we're actually spending now, every year on diesel, not to talk of NEPA, you can start to see that it makes business sense. My only concern, and I'm sure that this will come up as we go through the program, is that for systems like an MRI system, how sustainable or how is it possible for this to allow an MRI to run? But I'm sure we'll have answers to that. Again, thank you very much for inviting us, and we look forward to this summit. Thank you very much.
Thank you so much, Doctor. And of course, you'd get answers to your questions. So we'll move on to the next goodwill message from the MD Pillion Memorial Hospital, Dr. Ngozi Onya. A round of applause for her, please. Okay. Okay, we'll move on to the President of the Renewable Energy Association of Nigeria, Mr. Ayo Ademuluwa, is he here? A round of applause for him, please.
Good morning, everybody. Permit me to also stand on the existing protocol. Access Bank, you always like to take a very bold step. And congratulations. This is first out of a lot of people. And Mr. Greg, you've always been at the forefront, and the rest of your team. This is exciting for us in the industry. I believe that it's a landmark. Before I go, just to quickly answer the question that the doctor from Reddington asked. Yes, you can power your MRI machine with solar. The maximum power that you need for an MRI is 80 kilowatts when you're priming. It ranges from 25 kilowatt to 70 to 80 kilowatt. So if you need an 80 kilowatt for your MRI, it's not a problem, you can power it. So we can also power all the hospitals. I believe this is great. It's amazing. I believe it's going to work out well. The only worry I have is I don't know how Access Bank will be able to cope. You're opening a tap that would, when you open this kind of keg, that can cause problem for you. So I want to believe that your team is well equipped, to handle the multiple requests that are coming from various parts of the country. We are excited to have, Prof and the members of the Alliance here. It gives the wide network across the country with qualified developers that will be able to provide the needed support. I like the sequence of the design of the program in terms of how you want to go about it. And I like that you put in the design qualification by checking the monthly cash outflow with the repayment amount of the loan. For me, it's the most critical, So I want to congratulate Access Bank, and I want to congratulate everybody in the health industry for this, and I look forward to a fantastic event today. Thank you.
Thank you so much, and best believe we are able to handle the tap and the inflow of requests. Thank you very much. So we'll move on to the next goodwill message from the CEO of the Center for Integrated Health Programs, Dr. Bola Oyeledun, ably represented here this morning by Dr. Iyan Ayo. A round of applause for her, please.
Good morning, everyone, and thank you for having us here. I will join the previous speakers to stand on existing protocol. So I bring greetings from my CEO, Dr. Bola Oyeledun, who regrettably couldn't be here because of competing priorities. So she asked that I stand in. My name is Dr. Iyan Ayo. I'm the Deputy Director, Clinical Services Unit. So a little background about our organization. We're a not-for-profit, non-governmental organization that are multi-funded. So a few of our funders are the US government through PEPFAR, Presidential Emergency Plan for AIDS Relief, and we have the European Union and the Bill and Melinda Gates Foundation, to mention a few. So we partner with them to bring improved health outcomes to Nigerians through innovative strategies. So this is quite an interesting platform for us to join and to be a part of, because the echoes, I'm sure, maybe to some of you, I know a lot of us here are still in the health, we've been hearing the echoes of the freeze on foreign aid by the US government, and a lot of our work and work of other partners. In fact, a lot of the work in the health sector in Nigeria is actually funded by the foreign, by foreign agencies. And that has, in the last 1 month, it has really, been shaking, that sector for a bit. So just to bring the context locally to us here, the last 1 month, we haven't been able to do anything. So part of what our organization does is to, provide care and treatment in the HIV sector. So we are the lead implementing partner for HIV programs in Lagos State. We work with Lagos State University Teaching Hospital, Lagos University Teaching Hospital, and beyond treatment, we also, help the hospitals with infrastructure. Infrastructure would be, power generating, generators, would be solar systems and all that. So prior to now, I think about last year, with funding dwindling, not even the freeze, things like those infrastructures were cut off. So we weren't able to, help out the hospitals anymore with bringing in solar systems and even generators. We're asked to stop buying all those, spending money on infrastructure basically, and just concentrate on providing care and treatment. And I think last month we had a meeting with the stakeholders in Louth. And just like Bredington Hospital said, Louth spends upwards of 100 million naira on power every month. And it's a burden for them as well. Even though Louth is as big as Louth is a growing concern for them. So this initiative is, I think, will be welcome. Although what I fail to notice here is that I'm not seeing a lot of public government structures here. I'm seeing the big dogs from Bredington, but I didn't see government of Nigeria, like people from, Louth. Oh, okay, good to see you, sir, but maybe from the States as well. Because I think they're a good population, client base for what is happening here today. So we would, as CIHP, would be very glad to be partners and advocates for this. Because, in providing our services, the hospital needs to be empowered, to join us, to support laboratories, because we do support laboratories as well, but the laboratories need power to function. So we'd be happy to be partners and advocates for this. Although I would plead that I just saw something about interest rates being based on current markets. If Access Bank can do something into subsidizing those interest rates, because I think it would, go a long way to have more people join the bandwagon. Thank you so much.
Thank you. A round of applause for her again, please. All right, as we make progress in today's program, we would like to hear a testimonial video from the Chief Financial Officer of JNC, Yemisi Shola Oyebade. Is she here? Awesome. A round of applause for her, please.
Good morning, everyone. I would also like to stand on existing protocols and congratulations on what is happening here today, and it really gladdens my heart. I remember I'd seen a news yesterday, it was just a news flash, a woman that, I don't know if she had triplets or quadruplets, and they all died because of power. The last one was still alive, but they couldn't get him to an incubator early enough. So this is really a solution in season, and congratulations. So I am here to represent my MD, Mrs. Claire Masheye. She's the CEO of GNC International Limited. GNCI is a turnkey medical equipment company, and we provide a lot of these heavy-duty equipment. Some of my colleagues are here with me. I have our head of technical, and I have a head of medical and surgical. And I remember when we were coming, he had mentioned, he's really excited because he's looking for power solutions for the MRI, just like the doc from Bredington said. So we're actually very interested in having power solutions backup for the equipment that we provide in the healthcare space. Access Bank is really a family, and they've been with us right from the start. GNCI is over 21 years old, and Access Bank has been a part of that journey. When We were looking for a partner to handhold us. They were there, and even though Access Bank is hierarchical, but we feel it's a flat organization because you have access to anyone. We have a very fantastic relationship management team, and you can get access to anybody, even to the MD when required. So it's been a wonderful journey working with Access Bank. And in terms of financing, I want to believe the question that you posed, Doc, they're going to look into it. Access Bank is one that is known to be very flexible, and they're going to work with what you're bringing to the table. So for us at GNCI, it's been a journey of partnership. It's been a journey of progress. And we look forward to doing greater things with Access Bank in future. Thank you very much, and congratulations once again.
Thank you so much, Yemisi. A round of applause for her again, please. So right at this time, we would go into a demo session, basically taking us through the application process. As Njideka had earlier mentioned, you can scan the QR code here at the left side of the hall. But to just take us through a demo, I would like to invite Oyi from the AFF team, if she's close by. A round of applause for her as she comes to the stage.
Good morning, everyone. I hope you're having a very, very wonderful time here. And we're very, very excited to welcome you. On the screen here, you have the QR code. If you can just quickly go back to that, please. You can scan it. And when you do, it takes you to the website for the Sustainable Finance Accelerator. And if you can just quickly go to the website, but this QR code will be shown at intervals during the period of this program. I'm sure you would have seen a few of the QR codes have been just popping in and out of the screen. So if you just go to the website, you can see that everything about the program is basically explained here. We have what the program is about, what our objectives and goals are, what we hope to achieve in regards to numbers. If you can please kindly scroll down, what we hope to achieve. We have some of our partners and also those who want to work with us more. We're happy to put their logos on here and also work with them. We have what the program is about, what the benefits are, what we're looking to achieve, not just in a year, because this is a long-term project for the bank. And if you just go, just hover around the pages on the website, you can see about the program, how to apply, what the criteria are, what benefits there are that you can get from the program, and frequently asked questions that we get often. And also you can see there's a website and a phone number to reach out or contact as well. So if you go to the apply, we have, this is how to apply for the program. So you can apply either as a business or a startup. Now, for businesses, these are businesses who have been in operation for over a year. And for startups, are for businesses who have been in operations for under a year that apply for startup. And when you come to business, I think the form is categorized into three. There's basic information, and there's more information about the company, and then just other information that you think would be important to your application. So for basic information, we just want to know more about the person who's applying, about the company, about your operations. And remember, these fields a lot of the fields are compulsory. So one of the common issues that we get is people miss out on certain questions, and when they click on submit, they get errors. So we usually advise that you take your time and go through each and every section of the questions and answer them. If you go to the next, which then takes you to the next portion of the form, you can then decide what you're applying for. And I want to say that this is not cast in stone, because we keep adding more functionalities based off of how we interact with every one of you, we realized that there's more opportunity in the space for us to add things. Initially, we just had loan and seed funding, and now we've gone and added vendor, which means that you can now make an application to be a vendor to the bank. I mean, that deserves a round of applause now, doesn't it? So let's just go to, I'll run you through each and every portion of the form. So if you go to loan, for loan, you can just apply your business, what your loan amount that you're requesting for, how much in turnover that you're making, and just any additional information that may be necessary. Then when you go to next, you can just put any additional information that you think, again, will be important to your application. And once you submit, you get an automatic email that basically says we've accepted your application, and then the team will be in contact with you within the next 2 weeks. Now, what happens in the next 2 weeks is the team is asking for additional information. It could be business plan, it could be a letter, it could be anything else, just to help further your application. Now, we do know that in the past, a lot of applicants have, when we try to reach out to them for other information, they're not available. So it's important that you put your numbers and your email addresses in your application. So if you can go back to the seed funding portion, because each of these portions have different sets of questions. For seed funding, we want to know much more detail about your product, about your business, about your plans. We want to know the impacts that you're driving. So you have questions directed as to that as well. If you also go to vendor, we want to know more about your business. We want to know what exactly it is that you want to partner with the bank on. And after that as well, which is also within a 2-week period, you will get a follow-up email, follow-up contact information. So for seed funding and grants, at the moment, I don't know if anyone who has already applied, you should be getting information within today or today, on the confirmation of if you successfully been entered into either the capacity building or the seed funding. And the capacity building is starting sometime in April. So we're now collecting more applications for cohort 2, which will start June, July as well. So that's pretty much it. And if you have any questions, the QR code will keep popping up on the screen. If you have any questions, you can meet anyone in the t-shirt or find me. And we'll be happy to answer any questions that you have. Thank you very much.
Thank you very much, Oyi. I think we will just take a few minutes for some photo ops. I would like to invite some of our guests to, I don't know if our media, are we ready for the pictures? Awesome. Okay, we have one more goodwill message from the Honorable Minister, Federal Ministry of Women Affairs and Social Development, ably represented by the Special Technical Advisor on Climate Change and Green Economy, Prince Xavier Eyama. A round of applause, please.
Good morning, ladies and gentlemen. Please permit me to stand on the existing protocol and extend a special thank you to Access Bank, and especially Greg and the management and the executive management team, and obviously if I don't mention Prof, and the renewable energy associations in the house. This is Women's Month, so women, let's celebrate you. Go women. The Honourable Minister extends our well wishes to Access Bank and the management of Access Bank for this event. As we embark on this journey together, let us commit to championing the dual missions of advancing sustainable healthcare through solar energy and elevating the voices of leadership in women in health. Leadership of women in health. It is both an honor and a privilege to address you at this landmark event, the Access Bank Solar Health and Medical Facility Initiative in Lagos. We have come together not only to explore innovative advancement in sustainable health, but also to recognize the pivotal role that women play in the transformation of our communities, particularly in the health and the wellness. Acknowledging the importance of this initiative, solar energy stands as a beacon of hope, an essential tool for empowerment, especially for health and medical facilities serving our most vulnerable population. Access Bank's commitment to integrating solar technology into healthcare sector highlights a crucial understanding. Healthcare accessibility is deeply entwined with energy access. Envision a rural clinic previously hindered by unreliable power source, just like Professor Magnus had mentioned earlier, now illuminated by the sustainable rays of solar energy. With this transformation comes the ability to store essential vaccines, conduct surgeries, and provide continuous care for mothers and children. This initiative transcends mere health and wellness. It aims to establish a framework for sustainable and reliance capable of striving amidst our greatest challenges. Highlight the impacts of the health sector. Let's highlight some impacts that we think that this initiative will bring. As we progress, it's imperative to acknowledge who shoulders these significant responsibilities. The women of Nigeria bear the brunt. The women form the backbone of our healthcare system, serving as healthcare workers, caregivers, the community and community leaders. They are the custodian of the health within our families, communities, and nation. Women constitute approximately 75% of the global health workforce. In many villages and urban areas throughout Nigeria, it is women who operate clinics, educate families about the health practice, and advocate for health rights. Empowering a woman in health means empowering an entire community. The synergy of solar energy and women empowerment. I mean, I remember when I was a kid and I get injured, I don't run to my dad, do I? I go to my mom. So, in moving on, the synergy between solar energy and adoption of women's empowerment is profound. By integrating sustainable energy solutions into the healthcare settings, we are enhancing service delivery while simultaneously creating new opportunities for women to lead the innovation. Imagine a female entrepreneur leveraging on solar energy to establish health enterprise and reach remote populations. Consider the women who, empowered by the rise of solar energy, gain access to new technologies and training, enabling them to expand their professional capacity and contribute to the healthcare sector in unprecedented ways. We stand at a pivotal point or moment where solar energy can become a catalyst for female leadership in health. The intersection of solar energy and women's empowerment foster a landscape where sustainable health practice can flourish, creating a healthier and future for all. As we embark on this journey together, let us commit to championing the rural mission of advancing sustainable health through solar energy and work towards making this initiative also affordable. I think we also have to look at the interest rate and look at how we can make this the access to these healthcare provisions for people. So I think just as Magnus mentioned, the area we're talking about solar, and then we're mitigating the use of fossil fuel, which means there is other financial incentive that comes to the picture, such as carbon credits, and these incentives will help probably bring down the cost of the interest rate as we scale up. The more this activity is scaling up, the more sectors is being delivered with solar health, with solar technology. I think then we can now start having bulk carbon credit, and especially by the time we have our carbon credit registry established, I think that would really bring down the interest rate of this. So I think we shouldn't panic right now, and we should also embrace this initiative. And I thank Access Bank. Gregory, thank you for this initiative. Renewable Energy Association and the ladies behind, thank you very much for being here today. Thank you.
Thank you so much, Prince Xavier. We have one more goodwill message. Would like to invite Dr. Anita Nana Okoribido, the President, Women in Renewable Energy Association. A round of applause for her, please.
Good morning, all. Distinguished men and women here this morning. I am very pleased to be here. And since today is the eve of the International Women's Day, I would say congratulations to all the women in the room, and also congratulations to all the men too, because I always believe there's no man without a woman, and there's no woman without a man. You know, we have to balance the gender. And I thank all those who have spoken before me, and I thank the organizers, Access Bank, because I'm part of the W community, and we are very proud of you. Thank you. So today I would like to just mention something about access to green finance for Solar for Health initiatives, which I believe is very crucial for African rural women in particular, who often face significant barriers to health care and energy access. And I will do some deeper dive, if you give me just 2 more minutes, that the barriers to green finance for African rural women, number 1, they have limited finance inclusion. We all know that. Number 2, lack of collateral. And because of that, most banks don't want to have anything to do with African rural women, which I believe we need to look into critically, because all of us in this room, we come from one community or the other in the 774 local governments of Nigeria, and we have rural women in those communities. Let's give back to them. They have limited financial literacy. I always believe in community-based organizations where we do need assessments, and we can get all the women leaders together, and we can teach them a lot of things, particularly financial literacy, so that they can increase their earning power to be able to pay for healthcare delivery. And we have the cultural and social barriers. Rural women, you know, may have cultural and social barriers that really, you know, in firsthand limit a lot of their social impacts, particularly access to finance, and make it difficult for them to have financial decisions. So I can quickly suggest that we can do a lot of microfinance or group lending to them, mobile money and digital finance. We can also look into crowdfunding and community-based financing for these women. So Solar for Health initiatives, solar-powered health clinics would be very, very, you know, impactful at this moment. Solar-powered refrigeration in the clinics will be very impactful, and solar-powered lighting, illumination is key, so that the doctors and nurses can see what they do with the rural women at night in the health centers. So I will just say conclusion. Women in Renewable Energy Association will be very glad to work with Access Bank so that we can have access to green finance, you know, which is very essential, like I said before, for African rural women to access reliable and sustainable energy for healthcare, because they say health is wealth. And by providing innovative green finance solutions and supporting Solar for Health initiatives, we all collaborating with each other through the item 17 of the Sustainable Development Goal, collaboration, we will be able to empower African rural women to improve their health and well-being. Happy International Women's Day.
Thank you so much, ma'am. We've taken all your comments and would act on them accordingly. Thank you very much. So now we'll go straight into the MOU signing. I'd like to invite the Executive Director, Risk Management, Access Bank, as well as the President, Renewable Energy and Energy Efficiency Alliance of Nigeria, Professor Magnus Onora. A round of applause for Dr. Greg and Professor Onora, please. Thank you. A round of applause for them, please. Thank you very much. Can we have someone to help move the tables as we go into the round of pictures? Yes.
Yeah, they will be speaking.
The only woman.
Yeah, come.
It's Women's Day. Let's
Yeah.
have more women. Please.
Yeah. May I, on behalf of Board of Trustees of the Alliance, here, Governing Council, President of Associations, 7 associations that made up the Alliance, the voice of renewable energy efficiency associations in Nigeria, major developers, just name them. I want to, in a special way, thank Access Bank PLC for this initiative. We're just having a side talk with Dr. Shegu. Sustainable banking in Nigeria cannot be complete without mentioning the pioneering role of Access Bank. Put your hands together. So, and you can see the leadership. We are good to go in this partnership. We have started. In the partnership, we're going to have 300 projects. We have started with this solar health. I believe in the next 1 year, can take up another 50 more projects. I can consider them on the multiplier. We will assure stakeholders here that once you are involved in this project, go home and rest. I want to thank the special advisor to the Women of for putting further the fear of triple digit or single digit profit interest rate. In the long run, in the next 1 month or so, we will set up a mechanism for the carbon market for this Solar for Health. For one product we have, we'll be capturing the COD, the carbon registry, and that's what and it's an incentivizing mechanism. You can see once Access Bank deploys it, interest rate will come down, and of course, this subsidy will be a thing of the past. So thank you, Access Bank, and I believe we in the Alliance, we're forging full steam ahead. Our blood is like, doesn't use. Our blood is gushing. It's gushing. We're enthusiastic, just like what Ayo said. You know, Ayo said, be ready. Be ready. I know Ayo is a major developer. I know why he's saying that. Be ready. And Mrs. Ogrivido, she's in charge of 77 women. We're all in all the 77 local 774. So you can see the enthusiasm. So I think the day is bright for us. Thank you so much. I said thank you. Yeah. No, I didn't say.
Thank you. Thank you very much, my president. And in fact, my presidents here present. You know, when you are surrounded by presidents left and right, you have to be very humble and show your respect. Thank you. I think more significantly, this is the community that's delivering sustainability in Nigeria. People might not realize it, but when Nigeria speaks about net zero, transitioning, etc., this is the community that's going to make it happen. Because it's renewables that will take us there. So the work of Access Bank partnering with the Alliance is to ensure that the foundation that Nigeria is building for this transition is strong and is supported with the funds that are required, with the partnerships that are required. Every home, every office, every factory, every street, every hospital, every manufacturer in this country will require this journey. And this community is the one that is being relied upon to deliver it. People don't realize it just yet, but really, this is the future of Nigeria's energy transition. So we have to show them the due appreciation and the due respect and the due support to make sure that it happens seamlessly for the benefit of our country, for the benefit of our continent. So thank you very much, Ma. Thanks. Thank you very much, Ma. Thank you very much, sir. We appreciate it. Thank you.
Can we just hold on for pictures? Okay, sorry, please, can I crave your indulgence for more pictures? Sorry, Mr. Ayo, Prof, Mr. Greg, please just hold on. Can Dr. Tefa, please, can you join us? Prince Xavier, please, can you join us? Yes, not everybody. Okay, Mr. Ayo, Professor Magnus, Dr. Anita, and please. No, sir. Yeah, of course. Okay. No, they're not complete. Dr. Iyang, please join them. Njideka, please join them. Okay, so we take Yes, next set of pictures, please. Mr. Ayo, please, I need you to remain. Sir, please, you would remain as well. Professor Magnus, please, you would remain. Dr. Tefa. Please, can we have our executive from Access Bank? So, Mr. Femi, please. Mr. Lukman, can we have you on stage as well? Njideka, please come. Who else? Who else? Whitey? Yes. 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 Just before you go, can we have members from the Sustainable Finance Group? One more, sir, please. One more, please. One more, please. Thanks for indulging us.
Thank you.
Thank you so much. Thank you all so much for being with us. We are gradually coming to the end of this launch. And just also remind us, for those of us who are here in the room, I would like to take, to leverage on this opportunity, you could scan the barcode to my left, right? And you would be able to take part of this initiative. To give us a closing remark, I would like to invite the Group Head, Commercial Banking Division West at Access Bank, Mr. Lukman Martins. A round of applause for him, please.
Good afternoon, everyone. The guests, partners, and esteemed colleagues. Permit me to stand on all existing protocol. As we come to a close of this remarkable event, I want to extend our heartfelt appreciation to each of you for your presence, for your insights, and commitment to advancing sustainable healthcare solution in Nigeria. Today's launch of the Solar for Health Finance Solution is not just a milestone, it's a transformational step towards ensuring uninterrupted, cost-effective, and sustainable energy for healthcare facilities across the country. The discussions, the partnership, and shared vision we have witnessed today reinforce the urgent need for innovative solutions that improve healthcare delivery while promoting environmental sustainability. We are particularly grateful to our partners, stakeholders, and the leadership of Access Bank and RARE for their dedication to co-creating this product. Thank you, sir. Co-creating this product that directly address the challenges faced by the healthcare practitioners in securing reliable power. As we move forward, let's all remember that energy, access to clean and reliable energy is not just about infrastructure, it's about saving lives, as JMC enumerated a while ago. It's about saving lives, empowering healthcare professionals, and building a resilient health sector. We invite all stakeholders here today to continue championing this cause, ensuring that this solution reaches the communities and hospitals that need it most. Once again, thank you for being part of this journey. This program is an event along the journey. We still have a long way to go, and we count on our partners to cooperate in us implementing this solution. We look forward to the successful implementation of this initiative and to many more collaborative efforts that drive sustainable development. Safe travels. Safe travel as you live here. Thank you so much, everyone. Thank you.
Thank you so much, sir, and thank you all so much for attending today's event. There are quite a number of persons we're not able to recognize. We sincerely do apologize. I'd like to also tender our apologies to Dr. Akikomi Olukayode, the Secretary, Association of Private Medical Practitioners of Nigeria. Thank you so much, sir, for being in our midst. And also, like Lukman had mentioned, we wish you safe travels to your respective designations. Thank you very much. Have a good day.